What can be done to bring Medicare/Medicaid benefits to Floridians who need it that are being made available through the Affordable Care Act?
This is, quite frankly, not really a county issue. I'm certainly in favor of support, as I said, of supporting jobs and supporting workers and supporting the fair capital wages that we're engaging in right now. Medicaid and social services are a national umbrella that is a necessity, but it must be affordable and it must be applicable. And in fact, that these instruments have to be used properly. They cannot be a burden on society, but they have to do the specific things that they're designed to do. And they can't put an undue burden on our tax base.
I would go and rally Ms. Thompson. Let's say that. One of the things with Medicare and Medicaid that we have to be careful of is fraud. Fraud is a huge issue with Medicaid and Medicare. I think it should be available to everyone at an affordable price, but again, it's more of a state issue. The county commission really wouldn't have a lot to do with it, other than to go and help lobby at the state level, and we would be calling Ms. Geraldine Thompson to say, please help.
When it comes to access to preventative health care, there's a number of things that I feel that at the county level that we may be able to help facilitate. With the Affordable Care Act, Obama has allocated funds to the states that we can lobby for at the county level. And one of the things that I would like to do is invest in our economic interests that we have here in Orlando, Florida. We have the UCF Medical City. We also have Valencia College, who has the #1 nursing program, and one of the best nursing programs in the nation, and is the #1 community college in the nation. So what I would like to do is help implement more nurse practitioner-run facilities, more physician-run facilities to help provide access to these preventative health care at a local level and help these nurse practitioners and PAs open up their own clinics within our local areas to help provide affordable health care to the people who do not have any health care whatsoever.
Medicare should be protected for elderly because those people, they have worked and they have planned for early age because they cannot provide certain benefits to themselves. So Medicare should be touched or removed from the healthcare system. And Medicaid should be available to those who are in need for it. For example, some people cannot afford paying insurance premiums, but they get sick and they go to the hospital, they should be provided health care. And I think that the sick people need health care, not people, I don't accept any mandate. Mandate for what? So if I cannot afford buying insurance, I can get in trouble with the government? No. No mandate, but Medicare and Medicaid, yes, one can extend to everybody in the system.
I think the first thing we have to do is to tell our governor that now that the United States Supreme Court has upheld the constitutionality of affordable health care, that he needs to get busy implementing that act. There are so many unemployed individuals in the state of Florida, and he is doing a disservice to this state. We also need to deal with fraud, which is a major problem. It would probably surprise you to know that people in professional positions that you wouldn't expect to do this, a woman who uses her maiden name to qualify for Medicaid, doesn't divulge that she's married, and gets coverage for the birth of her children and the treatment of those children. We need to deal with fraud. We need to talk with the pharmaceutical companies, bring them into the discussion, but because of any healthcare, medication, the cost of medication is a big part of that. So it's a variety of things we